In other words, caseworkers need an updated cockpit so that they're better equipped for this emphasis on their role in well-being and to address well-being. As the needs change, so does measurement. So measuring well-being is different than measuring permanency, which is really tracking events, changing events in the child's life, or safety, where we look at risk factors, family factors, and safety outcomes. Measuring well-being requires a different approach to measurement. So thinking about measuring well-being, first, assessment is the act of measuring or evaluating something to understand its nature, its characteristics, or its quality. So that's what assessment broadly is. Assessing well-being in child welfare can take on a lot of different faces. It's a broader term and it has many different applications. But one specific form of assessment that is important for child welfare is screening. Screening is a type of assessment used to efficiently identify the presence or absence of a specific characteristic. So you're already familiar with screening, you've participated, it's everywhere. So for example, if you've done an eye exam, that's a screen. An eye exam doesn't say you need glasses, it says you need a further evaluation to determine if you need glasses and what types of glasses you might need. A TB test, most of you have been part of a TB test, if not all of you, and a TB test does not tell you that you have tuberculosis, it tells you that you need further assessment, that there's more information about that we want to find out and see if you actually do have tuberculosis and if you need treatment. So screening is a fundamental part of well-being in the conversation for child welfare. Our take on screening in child welfare is that we really need to understand the kids in the system who have mental health needs. So for the rest of the portion of this webinar that I'll be doing, we'll be using screening as a model of how measurement is used in child welfare and how it can be better developed as a tool for workers and their roles in addressing well-being. So among the kids in child welfare, there are those who need a referral or who need mental health services. But the trick is finding out who. It's not economical to do a full psychological evaluation of mental health need for all of these kids. And providing treatment to all of these kids also is not realistic, as well as not fair to the kids who actually don't necessarily need that. That would be a lot of time for them to devote. So screening is the process of identifying among those kids which actually need those services. And this has been moving forward in the country based on federal pressures and also in the state based on federal pressures and legislative moves, and also there's been some lawsuits. So we've identified three main approaches to identifying mental health needs in child welfare that have emerged as a result of all these pressures to work more closely on identifying well-being. So we'll talk about these three different approaches that have kind of come up in the field for identifying mental health need. And the first is not using a screening tool at all. And I would call that the eyeball test. So that's not using a tool, or if you use a tool, you use it after the decision's already been made. So that child welfare workers are deciding that someone needs mental health services just based on their judgment, based on their perception. This is also sometimes, I've heard it called a needs-based screening, which is kind of a misnomer, because if you know that there are needs, then you've already identified, you've already done the screening. That's the screening. You said that there are needs, and so that decision has already been made. And the screening can either confirm it or not, but you're not going to identify the kids that you might have missed with that needs-based assessment. So there are some strengths to this approach. The biggest one is that there are the least resources and time needed up front, but it's only up front. In the long run, we found that this is not super effective. So some concerns that come up with this approach is that there's strong evidence that it's ineffective, and the referrals are heavily impacted by bias from the worker who makes the decision, by their memory, and also by their judgment. And also, this doesn't include any direct report from youth or families. A second approach is use of an information consolidation tool. That's what I'm calling it, information consolidation tool, which is basically a tool that standardizes the process and documents worker perceptions during the assessment process. And then that information is later used to make a referral. And so these examples are out in the field. There's the CANS, the MIST, and SDM tools. So these tools are really methods of standardizing and consolidating information that's gathered during an assessment that's conducted by child welfare. Some strengths to this is that we have access to the respondents, the workers. That's part of their job, is to respond to these tools. And it can reduce errors caused by memory or inconsistency between workers. Not always, but that's part of the goal, and training is a big part of that. And sometimes it includes collateral information, so workers can look at the case file or talk to other adults involved in, other people involved in the case, and include that into these tools. But some of the challenges with this is that while these are typically effective for safety and permanency, these types of tools, they're not an evidence-informed approach for assessing well-being or measuring well-being. It heavily relies on the perceptions, judgments, and the training of workers so that they're accurate and consistent, and it's often influenced by bias. And it doesn't include direct report from youth or families. So the third approach that we're going to talk about is using evidence-informed measurement tools. And evidence-informed tools are completed by workers, well, not by workers, they're administered by the workers, and then completed by caregivers, youth, and others involved in the child's life in the assessment process. And the results of that tool influence the referral decision-making. There are several benefits to using this approach. Research supports the accuracy and consistency of the information provided by the tool, so we can trust the information of the tool if it's administered correctly. We get direct feedback from the child, youth, or family, depending on who's responding, and we eliminate the dependence on memory, bias, or judgment alone. It reduces inconsistency between workers, and it can include collateral information. It can also enhance the second approach that we just talked about, the information consolidation. So those are some of the benefits, but it also has some considerations. I didn't call these concerns. These are considerations that you would want to take into account. It can require more upfront resources and time. Implementation needs to be thoughtful, and the training and ongoing oversight is needed so that it can be sustained and that it's appropriately used in the future. But like most things in life, you get out what you put in. It tends to be the most effective approach, but it does require a little bit of planning and thoughtful implementation. So that brings us to the last portion of my part of the presentation, which is that it's important to choose tools that are appropriate for the purpose that you're using them for. So if you're using, Jared's going to talk more about reliability, validity, sensitivity, specificity. So those are some of the ways that we estimate the appropriateness of the tools. But for an example, in child welfare, I looked at all the tools I could find about mental health, general mental health screening. And out of all of those tools, none of them had specific trauma symptom questionnaires, questions in them, no trauma-specific items. And so if we're not asking about trauma, it's a difficult thing to identify. We sometimes miss things. And so usually when you're screening in child welfare, because the population is so heavily impacted by trauma, so commonly impacted, you typically need two tools, one focused on general mental health needs and one focused on trauma-specific needs. So that's one comment about the appropriate tools, but I'll let Jared elaborate much more about that. A second consideration for this third approach is that regardless of the tool you've got, they need to be implemented efficiently and effectively. So if I have a yardstick and it's the most precise, accurate yardstick in the world, but if I use it to measure my waste, there's a good chance I'm going to get inconsistent results or I'll get the wrong number. So even though that's a really good tool, we want to make sure that the way you're using the tool that you might use in your child welfare setting, that you use it effectively. And that takes a lot of planning and consideration. And Jared also is going to talk about that. The CEBC is a tremendous resource for both of these aspects of measurement. And Jared's going to discuss more each of these in more depth. So I'll turn it over to him.
All right. Hello, everyone. First, I want to start out by saying thank you to Brent for doing his overview of the different measurement approaches with all the different strengths and weaknesses to each. As he had mentioned, he touched on some topics that I'm going to be going into a little bit more depth on. So before I get into that, I did want to mention that when you registered for this webinar, you were asked questions on what types of information you were looking for from the webinar. So the CEBC received some interesting questions on specific tools and using measurement data in specific situations. So we wanted to respond to these questions by really letting everyone know that because every child welfare system is different, every organization is different, really the best person to answer these types of questions is yourself. Selecting and implementing a measurement tool is an understandably difficult challenge, and the purpose of my section is to provide you with the tools and understanding to address these challenges. And also know that if you have any additional needs after the CEBC Measurement Tool section or after using that section, please know that you can contact the CEBC for individual technical assistance. Okay, so without further ado, I'll dive in. And then also, just a side note, which I think Molly had mentioned, we do frequently refer to the California Evidence-Based Clearinghouse as the CEBC, so that's what that means when you see it and you hear me say it. So a few objectives. Starting out, I'm just going to provide a very brief overview of the CEBC for those of you who might be new or unfamiliar with our work. Then I'm going to be providing a walkthrough, very basic walkthrough to the CEBC website or the measurement tool section of the website. And then going into more depth by reviewing what makes a measurement tool evidence-informed, and then also talking about some considerations for selecting a measurement tool. All right, so I want to provide some brief background information on the CEBC for those who might be new to our work. The CEBC is operated by the Chadwick Center for Children and Families at Rady Children's Hospital in San Diego. In 2004, the Office of Child Abuse Prevention, which is a department of the California Department of Social Services, contracted with the Chadwick Center to create the CEBC. So the mission of the CEBC is to advance the effective implementation of evidence-based practices for children and families involved in the child welfare system. So the CEBC separates its work into two areas, the work on individual programs and the selection and implementation work. So the program registry acts as an online dissemination tool for evidence-based practices relevant to child welfare, which includes detailed information on over 300 programs that we review on a regular basis. And then the selection and implementation work is intended to assist agencies with exploring and adopting a new program by providing them with guidance and resources. So that's all the detail I'm going to go into on the CEBC program registry and implementation work. If you're interested in learning more about using the program registry and the implementation section, I have provided you with a link to the recorded webinar section on various EBP and implementation topics. The webinars are free and you can access them at any time. And there's also a link for the FAQ section, which provides detailed information on how to navigate the CEBC. All right, so moving into the CEBC's work on measurement tools. So the CEBC relaunched an improved measurement tool section in February of 2015 to what you see today. So one of the reasons for the CEBC promoting measurement tools is because it fits within the CEBC's work on bridging the gap between research and practice. We all know how challenging it can be for service providers to find time to conduct thorough literature reviews and critically review supporting research. So using the CEBC can help you save time. Another reason for having a measurement tool section is because measurement allows child welfare workers to effectively identify and efficiently meet the needs of children, youth, and parents. So measurement data can be used to guide critical decisions and help the case planning process. And then lastly, the measurement section supports child welfare agencies by giving children, parents, and youth a voice. Recall how Brent had talked about the commonly used eyeball test, and think about how critical issues might be missed when we fail to use objective measures. Someone who appears to have good well-being might not necessarily be doing well in reality. All right, so the measurement tool section of the website was designed with specific goals in mind. First, the section was intended to highlight only a select few measures that could be used by child welfare workers. So there are a lot of tools out there, but not all of them can be used by child welfare workers. For example, some require a clinical license to administer. Second, the goal of the section is to promote research supporting each listed measurement tool. So similar with the program registry, the CEBC provides each tool with an individual rating based on its current research evidence. So I'll explain the measurement tool rating process in just a few minutes, but the intention of the rating is to guide agencies with making decisions on tool selection. So it's important to keep in mind that not every tool out there has empirical evidence supporting its effectiveness, which actually leads me to the last goal of the section. And the CEBC also has a focus on reviewing tools that are commonly used in the field or marketed or used in California specifically. So it's not uncommon for tools to be given marketing buzzwords like evidence-based, quote unquote. So when in reality there is no empirical support justifying using that term. So similar to the CEBC program registry, we want to promote truth in advertising to help inform agencies in the decision-making process. Also, if several agencies in the field are utilizing a specific tool, the CEBC wants to review the supporting research for that tool so that if another agency is interested in adopting it, they can access the CEBC to learn what the research base is for that specific tool. All right, so now let me quickly show you how to access the tools section. When you go to cebc4cw.org, it takes you to our homepage, and then you will click on View Programs on the left-hand side. So from there, you will see on the left-hand side, there's a left side ribbon. Click on Measurement Tools, and that will take you to the Measurement Tool page section. So starting at the top, the page provides a brief explanation of the purpose and the tool requirements, a description of screening versus assessment, followed by a link to the measurement tool rating scale. And then on the bottom, there's a link to the list of reviewed measurement tools. So now I want to touch on the requirements for a tool to be listed on the section. So this is important information for agencies to know because this information could be factored into your decision to adopt a specific tool. So first, the tool needs to have training or a manual. So this is critical because it's a training or a manual is an element for ensuring that the tool you select will be administered properly and the results from the tool are accurate. The second requirement is that the tool must not require a clinical license. This is reported by the developer of the tool. The third requirement is that the tool must be used in the child welfare field. And then the last requirement is that the tool must have sound psychometrics published in a peer-reviewed journal. So this is what the CEBC uses to determine what the tool's rating will be. And I'm going to be reviewing what the process is and then also what specifically psychometrics is in the next slide. But before I do, please note that the measurement tool section is not intended to be comprehensive. There's just way too many tools out there for us to review. And the CEBC we have a preference for focusing on tools with strong research evidence and that are appropriate for the field. All right, so some important terms to know. I want to do a brief overview of what specifically makes a measurement tool evidence-informed. These are terms, the terms that I'm going to be talking about, these are important because they also come up on the CEBC website, so it's good to know what they mean. So first, reliability, which is the extent to which the same results will be achieved when repeating the same measure or study again. So really think of reliability in the same way that you would think of a person being reliable. A reliable person is someone who you depend on, they're consistent, you trust them. So a tool with high reliability is the same. Second, validity is the degree to which a result is likely to be true and free of bias. So validity is really important because it means that we know the results obtained from a tool are true. So for example, if you're administering a validated depression tool, you know that you're actually measuring depression and not something different like anxiety. And then on the bottom, you'll see a picture of three bullseyes, which is a common way reliability and validity are explained. So starting on the bottom left, you'll see that the tool is neither reliable or valid because it isn't hitting where it should be, and it's kind of scattered all over the place, so it's really kind of anyone's guess where it'll land next. In the middle, you'll see an example for a reliable but not valid tool, which it's landing where it should, it's not landing where it should be, but it's at least hitting in a consistent area. And then on the right-hand side, you'll see a tool is both reliable and valid, so it's consistently hitting where it should be. Okay, so just two more terms. Specificity and sensitivity are the last that we'll cover. First, sensitivity is a measure of how well a test identifies people with a specific disease or a problem. So a common example for sensitivity and specificity is tuberculosis testing. So many of us have had a TB test, so we understand how it works. But imagine this group of people on your screen is a group of new social workers being tested for TB. So the blues are negative and the oranges are positive. So sensitivity works to identify those with TB. However, it can also over-identify. So in the case of TB, some people do actually have a reaction to a TB test, but in reality, they don't actually have tuberculosis. We call those false positives. Specificity, on the other hand, is a measure of how well a test excludes people without a specific disease or a problem. So a test with 100% specificity correctly identifies individuals without tuberculosis, also called true negatives. However, some people may be incorrectly identified as negative, also called false negatives. So again, this is important information because it's critical that agencies factor research evidence into their decision to adopt a specific tool. Also, this is really important because it highlights just how much work goes into creating a sound measurement tool. So think about tools that have not examined their reliability, validity, sensitivity, and specificity. So using untested measurement tools is risky because we really don't know what we're getting when we use them. All right, so the CEBC uses research on tools to evaluate the evidence supporting the tool's effectiveness. This is an image of the measurement tool rating scale. First, note that the CEBC only rates the English language version of the tool unless otherwise noted. So as with the program rating scale, the tool rating scale does not categorize tools as evidence-based and non-evidence-based, but provides ratings that indicate varying levels of supporting research evidence. So starting at the top, you'll see the A rating, which is psychometrics well demonstrated, and that includes 2 or more published peer-reviewed studies that have established the measure's psychometrics. A B would be psychometrics demonstrated, so that's 1 published peer-reviewed study. C does not reach acceptable levels of psychometrics, so that includes a preponderance of published peer-reviewed studies have shown that the measure does not reach acceptable levels of psychometrics. And then lastly, NR, which stands for not able to be rated, which includes published peer-reviewed studies demonstrating the measure's psychometrics are not available. So the rating process for each tool starts with a review by 3 separate scientific reviewers who look at the research that is available on a specific tool. If the reviewers they submit the rating to the tool, to the research manager. If there's agreement on the rating, the tool is posted to the website. If there's disagreement on the rating, the difference is then resolved by the scientific director of the CEBC. All right, so back to the main measurement tool page section. Here you can see on the bottom is how you access the list of specific measurement tools. And I know this is super tiny font and probably hard to read on your screen. I'm going to be zooming in just the next couple slides. But this is an image of what you would see when you click on the list of tools. As of now, these are all the tools that we have reviewed. Here you can see the measurement tools are broken into 3 separate categories. So what I'm going to do is I'm going to highlight each category and just kind of call out a few of each of the tools. So starting with the first category is tools used for screening mental health needs. So that includes ages and stages questionnaire, the modified checklist for autism in toddlers, the mood and feelings questionnaire, the mood disorder questionnaire, pediatric symptoms checklist 17, and the strengths and difficulties questionnaire. So these are just some examples, and you can click on any of these on the website to get more detailed information on each tool. So the next category only has 5 for now, but we call these tools used for assessing family attributes. So that includes the child abuse potential inventory, the family assessment form, the family development matrix, keys to interactive parenting scale, and the protective factor survey. And then the last category is other tools, which is pretty much tools that don't fall within the other two categories, but I'm sure will be growing. Right now, this is obviously just two tools, which include the Child Exposure to Domestic Violence Scale and the Ohio Youth Problems Functioning and Satisfaction Scale. So you're welcome to explore the website and kind of read more about each of those individual tools. I'm not going to be highlighting any specific tool, but I just want to tell you that this is what we provide for each tool that's listed on the CEBC. First, the scientific rating, which each tool would either receive an A, B, C, or an NR, as I discussed. So right now we have 14 A's, 4 B's, 0 C's, and 2 NRs. Then we also provide a description of the tool, and that includes the target population, how long it takes to complete, who completes it, the different modalities, meaning if it's paper or pencil, if it's online, the scoring information, so is it a manual scoring on paper or is it online, the different languages that are available, training requirements, so does it require a degree to use, and the availability, so does it cost money and where do you access it, where do you obtain it. And then we also include developer contact information and then a summary of any relevant research. So unfortunately the slides are a little bit out of order, so I'm going to next highlight the tool selection considerations. As Brent mentioned in his section, a ruler by itself is a good measurement tool, but you don't want to use a ruler to measure your waistline. So some measurement tools are better fit for a task and for an organization than other tools. So since there are so many tools out there, how do you know which one to choose? There are many considerations for selecting a tool. This information comes from a field of study called implementation science, which examines the factors that support successful implementation of an innovation. So that could be something like an evidence-based practice or even a measurement tool. So what implementation science tells us is that the success and sustainability of a measure is determined by an organization's ability to critically think about how well the tool fits with their organization and their needs and also their service population. So the features of a measure is a vital consideration. So things like the length of time to complete, the cost, the translations and cultural appropriateness, the informants, the age range, and even the research support, which I talked about earlier. So this information can be located on the CEBC, or you can also contact the tool developer if you're trying to learn more about a specific tool. So other important considerations are organizational factors. So an important consideration is that a tool is administered in a timely and useful manner. So using a measurement tool is intended to enhance what child welfare workers are already doing. So think about how court reports can utilize data to strengthen a case decision. If administering a tool is something that is viewed as an additional responsibility or administered after a decision is already made, then the tool won't succeed in its purpose. So this really brings me to the next point about culture change. It's important that organization leaders recognize and support child welfare workers in this new type of approach. Don't underestimate the influence of staff attitudes and confidence on measurement tool success. So these are just a few types of factors to be mindful of. You can read more about selection considerations on the CEBC selection and implementation section, which is focused more on EBPs, but you can apply the measurement tools as well. And also be sure to consult the tool developer to learn more information. Okay, so finally, I want to get into the future of measurement in child welfare. We want to give you a glimpse of what the future holds for the CEBC measurement tool section. It's important that everyone know that this is an emerging field, so expect to see more tools to support in this area to come. Currently, the CEBC is reviewing additional tools on trauma So check the website periodically, or you could even sign up to receive email updates on the CEBC. And also, well-being is broad in terms of how you can measure it. So we're considering additional topic areas. One such area that we're looking at is life skills. And finally, we want to mention that how child welfare measures well-being is an overall new topic. So expect to see how a lot more attention paid to this topic, specifically in areas like MSW, curriculum, or even professional development and continuing education opportunities. Okay, so I want to now open it up for any questions that everyone has for either Brent or myself.
Yeah. I see one question that came in earlier, and I can talk about that briefly. So the question is, what is the distinction between screening and assessment? I always thought the CANS was an assessment tool, but here it seems to be described as screening. So first, the distinction, assessment is a broader term. Assessment is evaluating for a characteristic or some quality, and then screening is a specific type of assessment. Screening is identifying based on a single characteristic to distinguish those with that characteristic and those without, or more than one characteristic. So the reason that the CANS was included was when I was talking about different approaches, those are approaches that I've seen being used to screen in child welfare settings. So some jurisdictions or organizations are using the CANS to screen. And that's partially why I brought it up, is because I think from my understanding of the CANS, it was developed as an assessment tool or a way to consolidate information through an assessment, and using it as a screening tool. That you're kind of highlighting one of the questions there is that usually for screening, especially evidence-based screening, there's information about what score you need to distinguish those who have significant mental health need from those who don't. There's information about sensitivity, specificity, and so information consolidation tools tend to not have that capacity, and that's why that second approach was one that has some limitations that we discussed. And so, and if you use an information consolidation tool like the CANS, but then add to it evidence-based measurement tool, then that approach would be much more successful in our point of view, because then you also you get the best of both worlds. But to use the CANS alone as a screening tool, as it's done sometimes, that's more likely to lead you down a road that is going to screen in people who maybe shouldn't be screened in, or screen out people who maybe shouldn't be screened out. So that's why we brought that up, and that's my understanding there.
Okay, it looks like we have another question. What is the implication of these tools for the fields of substance abuse and child welfare?
So, yeah, so we spoke specifically about mental health. We haven't spoken as much about substance abuse, or behavioral health is mental health with substance abuse or use included in it.
Hold on.
In terms of measuring that, because measuring well-being in general is new, as Jared spoke about, it's kind of an emerging area, I think, in child welfare. Substance abuse is, I think, developing in that context. I'm not familiar with that. It's not something that I've studied or been part of, and so I'm probably not the best authority on that, but I understand that things like commercially exploited kids, are screening for that, that's rolling out. I think there are other areas that are rolling out and kind of being brought into the field, and it's kind of determined by how we define the field and what the needs of the field are. And so if the needs are that we need to identify substance abuse and substance use, then absolutely we would start to screen for that. Yeah, I mean, I don't know if Jared has anything else to add.
No, I would just add that I think, as I mentioned in the last slide, that this is an emerging topic. We're learning more about it, and how we measure well-being is kind of evolving. And so from the CEBC perspective, if this is something that comes up as something vital to be measured, then I can see from the CEBC, the future of the CEBC measurement tool section, is that something that we could potentially target and look at specific tools in that area.
Okay, and it looks like we have another question, so we'll take a look at that.
California SDM and CAT are used by
So the question is, in California, SDM and CAT are used by a majority of counties for child and family assessment. Where do they fit with the presented model? And from my understanding, I think all counties will be using SDM very soon in California, all 58 counties. And as I mentioned earlier, for evaluating like risks for safety and permanency and for the assessment portion of the child welfare, I guess like the intake process, SDM has been a really useful tool. It's helped standardize the process so that when one worker makes a decision about a child, it's guided by the same information that another worker would use if they were to assess that same child. And so that's been a very useful tool and remains as an important part of child welfare. And so when we're talking about well-being, SDM would fall under the information consolidation category. And so we're consolidating information that workers get during their assessment process. While that information is necessary and important, it tends to not, what we find is it tends to not pick up on mental health need or trauma-specific need entirely or completely effectively. And we also haven't seen research supporting it as a use as a screening tool. And so what we see happening is that people are using SDM as they always have, but then also adapting in their systems to screen specifically for mental health or trauma needs. And instead of relying just on SDM information, which would probably be a less complete way to do it, they're adding in tools to the process. A lot of times the screening portion, if we talk about screening for mental health need as an example, that portion is conducted before the case report is due, the court report is due. So workers can use that information in the court report and make referrals based on the information they get at that point. So that's, I think that answers the question, but feel free to follow up with a second question if there's something more specific that I didn't discuss in there.
All right, and it looks like we have another question that we're going to take a look at. So what are the best screening tools available for CSEC?
I can do that.
Yeah.
So I think that's a good question, and I mean we're not going to specifically get into individual tools that are out there and what are best fit to measure any one thing. So I think that that's a question that you should definitely follow up with us for individual technical assistance. And like I had mentioned in the tool selection considerations is, I mean, there could be a bunch of tools out there that measure this one particular topic. That doesn't necessarily mean that one is better than the other. They all have to have different, information. They all have different aspects that need to be considered when you're making a selection decision. So it's more than just saying this one's better than another, because there are organizational factors and there's research factors. There's all kinds of things that we need to look at. And so it's hard to make that type of recommendation. So please follow up with us if you're looking for more specific TA.
All right, are there any other questions from anybody out there? All right, so I think that the last thing we wanted to talk with you guys about was the Chadwick Center's annual conference, the San Diego International Conference on Child and Family Maltreatment, which is January 25th to January 28th, 2016, with pre-conference institutes and trainings on Saturday, January 23rd and 24th. This is our 30th year and offering a distinctly international multidisciplinary conference known for its quality evidence-based sessions given by renowned expert faculty. So please try and come to that and join your colleagues from around the world in renewing your passion to make a better world for children and families. And it looks like that will do it for us today. Don't forget that we will be emailing you shortly with a link to complete a short and easy survey about this webinar. And thank you for attending.
Thank you, everyone.
Thanks.